Hello everyone. Today's video is about what I feel is the hands down best therapy method that I have ever come across. It's something called internal family systems therapy, and I'm just going to talk a little bit about my clinical experience with it up to this point and share some resources if you want to learn more about it. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So, internal family systems therapy was developed by a clinician. He's a PhD. His name's Richard Schwartz. Can't remember if he's a psychologist or what his exact credentials are. I don't remember off the top of my head, but and he was really, really brilliant guy. He developed this method about, I think, 20 some odd years ago. He outlines his story in the book, Internal Family Systems Therapy. I recommend the second edition because it's updated after the first edition. He outlines the story in there and basically just kind of how he pieced this together after trying and failing with a number of different therapy methods that he had learned in school and worked with different mentors and things like that. And he kind of wound up piecing this together from a few different angles. And anyways, it's something that's been, he took quite some time to develop, but it has been very helpful for many people over the years. I learned about internal family systems therapy after reading the book, The Body Keeps the Score by Vessel van der Kolk. So he has a whole chapter about IFS therapy in there. And I'd kind of heard about it through the grapevine, but it just didn't really know much about it. Then, read The Body Keeps the Score, and then decided to read the Internal Family Systems Therapy book, and it just really, really blew my mind. As I read through the book, I had just so many aha moments about, recognizing different things within me, different, patterns and things that I had happened to me in the past and different behavioral tendencies and traits and things like that. I had so much more insight into things related to my wife and my kids and family members, my mom, my dad, my sister, and then also lots and lots of patients as well. So it was very, very insightful around a lot of things to do with human nature and different patterns and why we do some of the things that we do. With internal family systems therapy, I mean, really the book is read the book or listen to some interviews or podcasts with Dr. Schwartz. That's the way to get the maximal amount of information. But just very, very briefly, the whole premise behind internal family systems therapy is that who we truly are is what they refer to as the self. So the self is when you're feeling confident, when you're feeling courageous, when you're feeling curious, when you're feeling creative, when you're feeling connected, when you're kind of feeling like your very best self, like you get out of bed on the right side of the bed and like you're feeling great, like that's your self energy, that's who you truly are. But then we also have parts that help to comprise who we are as well. So who we truly are at our essence is the self. But then we have parts that are kind of like aspects of ourselves, or like kind of hats that we put on depending on what's happening in our lives. So for example, there might be a sad or depressed part that would come to the forefront when something sad or depressing happens. Like you're a little kid and your goldfish dies. Like it's reasonable to feel sad, or somebody teases you on the playground. It's reasonable to feel sad. Or if, say you're waiting to hear news for, a loved one is waiting to hear back about a, pathology report, and like, is it cancer or is it just benign? It's reasonable to feel anxious, having some anxious feelings, because that's kind of a stressful situation. If someone, if you make a bad choice and I don't know, you're a little kid and you steal candy from the store or something like that, and you feel guilty afterwards, that's appropriate. That would be a guilty part that would come forward. And so, we have these different parts that allow us to express appropriate ranges of emotion depending on, life circumstances that happen. However, what we want to avoid is becoming what they call blended with a part. We don't want to feel depressed all the time. We don't want to feel anxious all the time. We don't want to feel guilty all the time. And that's when, basically that's a sign of pathology. So folks don't generally go in to see a therapist saying like, I just feel really great all the time, and that's a problem. It's like, no, you go to see a therapist because you're having issues with, anxiety or perfectionism or OCD or addictions or phobias or whatever it happens to be. So the whole idea with internal family systems therapy, to my understanding at least, is that when you're working with an IFS trained therapist, they're going to help you to identify which parts are that you may be blended with, and then try to figure out why that's happening. One of the things I really love about internal family systems therapy is that it's a very loving, very accepting therapy approach. and not throwing other therapy methods under the bus, but to my understanding, a lot of other therapy methods, you're kind of approaching symptoms or issues with, like, anxiety or depression is kind of like, oh, like I just want to get rid of the anxiety, want to get rid of the depression, I want to get rid of the guilty feelings, and of course we don't want to have them. Of course that makes sense, but with the framework of internal family systems therapy, the parts that, like, the guilty part, the depressed part, the anxious part, they're not vilified, they're not looked at as being bad. It's all about trying to understand why they're doing what they're doing. And in every single case, those parts are doing what they're doing to try to protect some other part that they feel is more vulnerable. So using the internal family systems nomenclature, we have these like protector parts, like so managers and what they call firefighter parts, and they're typically protecting what they call exiled parts. So these parts that are just so kind of like raw and vulnerable, if you will, that these other parts kind of step forward to try to protect them. So to use an example here, hypothetical example, let's say there's a little boy, and he has a mom who is a perfectionist. She's kind of a neat freak, and probably because she has some parts that were leading to that. But we'll just talk about from the little boy's perspective. So let's say his mom is just like a perfectionist. She, like, everything needs to be neat and tidy. So he comes home with like dirt on his pants. She's yelling at him. His room's not clean. She's yelling at him. And so he's getting the message that if you aren't, if you're not tidy, if you're not neat and clean, if you're not being perfect, then you're not going to get your mother's love. So a child feeling deprived of their mother's love, or their father's love for that matter, that's the end of the world for a child. Like their parents are their sun and stars, and so if that little boy is feeling like, oh, I need to be perfect, I need to be neat and tidy all the time in order for my mom to love me, then he is going to develop a perfectionist part. Then he says like, okay, like it's crucial for me to be perfect all the time. But then of course it's a fool's errand to try to be perfect all the time. We can't be, because we're humans and fallible and all of that. And so he's going to maybe develop an anxious part where when he realizes, oh, I wasn't perfect, I didn't get 100% on the test, oh, I like left a little bit of dust on my room or something like that, then he's going to develop this anxious or this hypervigilant part that's going to come to the forefront as well, because you can't be perfect all the time. So at the end of the day, so then he grows up, he's 40 years old, he's like, goes to see a therapist, like, yeah, I'm a perfectionist, I got anxiety, what's going on? Well, working with those parts in internal family systems therapy, the therapist would hopefully help him to figure out that, like, oh, you've got this part that feels unloved, and so the anxious part and the perfectionist part have stepped forward to try to distract you from that part. Whereas in reality, of course, like, people are perfectly lovable when they're not perfect and tidy and clean all the time. But again, that got hardwired into his psyche at that early age. And so he developed these protector parts, these manager parts, so to speak, to help him sort of protect him from those terrible feelings of feeling, unloved or unworthy from his mom. Again, simplified sort of example here, but just for the sake of an example, we'll run with that. So if that individual, if that fellow was to work with an internal family systems therapist, then what would ultimately happen in those therapy sessions is that, he would get into a kind of a relaxed state, maybe a little bit of a quasi-meditative state, and then start to connect with those parts. And we all have different kind of kinesthetic tendencies. So some of us are more, more like, so we all have more we all have different sensory dominances. So some of us are more visual, some of us it's more of like a feel. Evidently some people out there are like more nasally inclined, so they're kind of more smell driven. But for a lot of people it's either like, auditory, visual, or maybe more kinesthetic, like tactile, so to speak. And so as he's kind of, sort of scanning his body, kind of connecting with those parts, it's like, oh, okay, I'm kind of like feeling that anxiety. Maybe I'm feeling it in my chest, or maybe I'm seeing a personification of that anxiety, and it might be like a person, it might be someone from a movie, it might be like a just miscellaneous made-up character or something like that. But then as he's connecting with those parts, then kind of starts this internal dialogue, and again, either kind of getting feelings from those parts, or maybe sort of hearing like a bit of a dialogue, or seeing a certain scene unfolding. Then it will lead him, as the therapist is leading him through this, kind of lead him to see like, oh yeah, like so that thinking about the perfectionism part, and then that perfectionism part leads into like, oh, there's this kind of anxious part that's coming up there, and then maybe it triggers a memory of like, oh yeah, like I remember like just being really, really stressed out when I was a little kid if like, I didn't have everything just perfectly neat, and even if I thought I did great, my mom would always find something wrong with what I had done or something like that. And so then it would lead back to like, oh, there's this exile part, and then there's a whole process of kind of connecting with that exile part as an adult, as that 40-year-old in this example, kind of connecting with that little boy part and just saying like, no, like you're worthy of love. Like, you can be as messy as you can be and you're still worthy of love. And so that kind of the adult version, your modern day version of you connects with that younger version, and, gives them the kind of the love and care and support that maybe they felt deprived of at the time. So there's kind of these, this kind of like internal healing process that happens with this. And so I actually do some IFS therapy with my patients in practice, and it's amazing what happens in these sessions. I mean, maybe hearing it explained this way, it might seem a little bit, I don't know, maybe simple or something like that, but it's incredibly profound. Like, the tears that are shed in my office, the afterwards folks saying like, I just feel so much lighter, I feel so much better, and then seeing the impact in their day-to-day lives in terms of like just having less anxiety. Parts therapy, so the other name for IFS therapy is parts therapy. Doing parts work with folks, it can help with their physical symptoms. I have patients who have reported having like their IBS symptoms are better, their sensory processing issues are better, their headaches and migraines are better, their energy levels start to get better. I've seen some incredibly profound changes, even folks who have been doing IFS therapy, and we do brain mapping, as I've talked about in other videos, and looking at the results from their brain maps, that sometimes the reason we do the IFS therapy, or I refer out for it to other clinicians in some cases for more like complex cases, folks with complex PTSD and things like that. When we then do brain maps again after sorry, take a step back there. I think I forgot to say what I was meaning to say there. So folks who are, say they have a brain map, they're doing neurofeedback, other types of primal trust, other types of therapy methods to help with their nervous system regulation. In some cases, they get stuck. They're improved, and then they hit a plateau. We look at the brain map and we look for these patterns of like kind of trauma internalization or unprocessed trauma, and say, okay, probably not going to be able to neurofeedback that away. I think you're going to need to work with someone. We either do some IFS therapy in my office or refer them out to someone else. And then when we do another brain map afterwards, we'll see those trauma internalization patterns on the brain map looking better. It's very, very cool to see those objective changes. With the IFS therapy, kind of seeing those objective changes on the brain map, but of course, much more importantly, seeing those positive clinical outcomes, especially in folks who say, I've been doing therapy for, I've done every therapy you can think of for like, 20 plus years, but like, I've never heard of IFS therapy. They start doing IFS therapy and they see these positive changes. It's really, really profound. So I see the timer is going up here, so I will leave it there for now. If you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. As mentioned at the start of the video, Internal Family Systems Therapy, second edition by Richard Schwartz. That's the book, and it's great. There are some other clinicians who have written books, and there's IFS workbooks. There's specific books using IFS therapy for addictions, and there's like a couples kind of like family counseling kind of IFS therapy books out there. So lots of great resources out there. Many clinicians out there are certified in internal family systems therapy, so they are out there. If it's something that strikes a chord with you and you're thinking like, oh, I'd like to pursue that, there are lots of folks out there that do this. And Dr. Schwartz, as I alluded to, has been on many podcasts. There's YouTube video interviews with him. You can actually see live demos of different IFS sessions. I will say, like I've gone very deep down the IFS rabbit hole, as you might be able to tell from this video. I haven't been able to find a pre-recording of an IFS session that like really fully does it justice. The ones that I've seen are like, say, someone on a podcast episode and he's doing a session with the host, or like a live interview, like on a YouTube video, and it's understandably, it's such a personal topic, but it's I don't want to say it's contrived, but it's just they keep it pretty superficial, I guess. I haven't really seen like like what I've observed in office. I have not seen the full effects, that type of thing, like on another platform. But you can at least get a sense of what the whole process is like from some of those resources. If you yourself have used IFS therapy, if you have any opinions on it, please consider leaving a comment in the comment section below. If there are other therapy methods out there that you have found to be helpful, please let me know. I've looked at many different types. I've used other ones in my practice. Things like family constellation therapy can be very helpful. EMDR can be very helpful. I have patients who have done really well with somatic experiencing, and then of course there's a place for other therapies like cognitive behavioral therapy and things like that too. So if there are any comments, please post in the comment section below, and I'll leave it there for now.